Hello, Mr. Johnson. How are you today? Doing well? Okay. My name is Jenny, and I'm a nursing student at Felician University. I'll be taking good care of you today and changing your wound dressing out. I hear that you just had a small bowel obstruction and you had surgery on that area. So definitely want to make sure that that's nice and clean for you. So first things first, I just want to ask you, can you just give me your name and date of birth? Charles Johnson, March 3rd, 1946. Charles Johnson, perfect. March 3rd, 1946. All right, and you have any allergies that I need to be aware of? Allergies, latex and shellfish? Okay, great. I'll note that. Okay, perfect. It's in here. All right, so let's get started. What's your pain like today? Do you, on what pain scale of 1 to 10, would you say your pain's a 1 being the least amount of pain or 10 being the worst pain you ever felt? It's about a 1 or 2? All right, that's great to hear. I'm glad that you're healing nicely. Well, if that changes at any point today or during the procedure, please let me know and we'll definitely, get some medication for you so that the pain will be less, okay? All right, so I'm going to go wash my hands, go set this down, and I will be right back to start your wound care. I'm gonna close the curtain first too. Okay, I'm gonna raise your bed. I'm gonna put the side rail down. All right, just gonna wash my hands. Okay. All right, 20 seconds. All right, so I'm gonna go ahead and remove your this part of your gown for a little bit. Just take the sheet off. Okay. Just gonna look at the dressing. There doesn't look like there's any drainage on the dressing, which is good. All right, I'm just gonna remove the tape gently, okay? All right, at any time if it hurts, let me know, okay? Looks like there's no drainage on the wound, there's no blood. Everything looks great. That's good to know. Okay, just gonna look at it. I don't see any color. I don't smell any odor. There's definitely no drainage, and the color looks a little red, just a little bit on the edges. All right, and I don't see so I do see redness. I don't see any ecchymosis. I don't see any edema. I don't see drainage, and the approximation is nice and closed. It's a nice closed suture. Okay. So now I'm gonna go ahead and I'm gonna set up my sterile field. So you just hang tight for a minute, okay? Remove my gloves. I'm gonna wash my hands. Got my sterile gloves, my dressing changing tray. First things first, I'm going to take out the gloves, set them to the side because I don't need them, and I'm going to take out this drape. Just going to place it right here, right side up. Now I'm going to go ahead and empty out everything on this. That's good. Just take this off and put this in the garbage. Alright, so first things first, I'm going to go ahead and open my sterile gloves. Take it out. I'm going to go ahead and put it on. Okay, my hands are sterile. I'm gonna go over to the dressing chain. Just put everything upright. It's within 1 inch, okay. All right. Okay, I'm gonna go ahead and I'm gonna open this. Add a little bit more. Okay, and then I'm gonna go ahead and I'm gonna take the trash bag, just put it over there. Okay, you doing all right, Mr. Johnson? I'll be right with you. So I'm gonna first measure the wound with the centimeters. Got 10. Okay, we've got 27 centimeters, and it's 1.5 centimeters wide. Just all set in there. Okay, next thing I'm going to do is I'm just going to clean the wound. Okay. Just going to clean the wound like this. From clean to dirty. How does that feel, Mr. Johnson? Everything's all right? I'm glad to hear it. Thank you. Okay. Sides of it. Last one. All right. So now we're done with that. I'm gonna go ahead and grab my gauze. I'm just gonna place it with my sterile hand on the, even it out there. Okay. Now I'm gonna grab my tape. Okay, I'm just gonna tape it down here, Mr. Johnson. almost done. 2 more pieces of tape. Okay. Okay, I'm just gonna initial the wound, okay? All right. All right, how are you feeling, Mr. Johnson? You're doing all right? Okay, I'm just gonna clean up here and then we'll call it a day. I'm gonna put the scissors in the sharps container. Just gonna test this all out. Just make sure the computer was still on. I'm gonna put this all in here. That's off. Now I'm gonna go ahead and wash my hands, okay? Bag this up. Alrighty. Looking forward to dinner, Mr. Johnson? Yeah. It's good. I hope you get your protein in to help you with your wound healing, okay? Gonna take the biohazard out and I'm gonna cover you up here. Okay. I'm gonna put your call bell in reach, okay? So if you need us, please call us, okay? We don't want you to exert a lot of motion around your abdomen, okay? So be very careful and please call us if you need anything. And I'm gonna lower your bed, okay? I'm gonna put your side roll back up. All right, Mr. Johnson, and that's all for today. I'm just gonna reiterate, try not to do a lot of exercise or physical activity to strain your mid abdominal section, okay?